you like some tea to make it? Could you make 2 coffees? One for me. Mine's a half cup.
There is no.
Remember,
Okay.
you can purchase
Whatever.
all of Dr. Morgan's products at her website at
What?
www.
Why is it so short?
Because I started it in the middle.
Now it's time to sit back, relax, and enjoy.
One of the plain ones, like the blue.
Welcome to Breakfast.
Your video isn't even starting.
Yeah,
on
Facebook. Facebook is...
Hi, Instagram. Good morning.
Hi, Instagram. This is one of those Facebook's never going to start.
Well, we could do it on my phone maybe then, because usually if the computer doesn't work, the phone will. But it says it's live. Are we live
No,
on
it
Facebook?
says it's not. You do?
No, it says we're live up there. So
Really? You have us on Facebook?
That probably means it's going to crash.
Good morning. Can we say technical difficulties are our middle name? We
What?
can. We can.
This is Facebook's fault, though. This isn't our fault.
This is Facebook's fault. It's spinning on my
Our
computer.
screen just shows that we're waiting to join.
But Joey
apparently-
says he can see us on Facebook, so so we're going to assume that we're there, here, wherever we are.
We're there, but we're here.
Technical difficulties. You know, and I'm supposed to be the person teaching other people how to do this.
Okay. Yep. I got us. Yep. There we
Yeah,
are.
okay, there we are.
Okay.
Cool. Yeah. All right. There's 53 other people there with you. All
That
right.
are just enjoying absolutely nothing.
Okay. Sorry, guys. So I've got Gwen with us today, and a lot of you have said, "Hey, we haven't seen Gwen lately. Where's Gwen?" She's here.
I've been so busy.
She's working
So
to death.
busy.
We all are. You know, it's if you can figure out how to put 27 hours in a day, we're working on it. Since I don't sleep anymore.
Me neither.
Yeah, exactly. So, anyway, Mila had surgery Tuesday.
What day is today?
I think today's Thursday.
Yeah, it was Tuesday.
Okay, so why don't you give us the background for why Mila had to go have surgery?
Yeah, so a few years ago, well, actually, at the very beginning, about four, maybe almost 5 at this point years ago, Mila, I lived in an apartment, so I would take her to the dog park and let her play. I would take her for long walks and hikes and things. And she started limping in her back left leg. I took her to the vet, did not have the greatest experience, shocking. And basically they said, oh, she probably has a partial tear of her cruciate ligament. So I obviously reached out to my mom and I said, okay, like what are some of the things that I can do for her? And so we put her on basically bed rest for a little while. She had acupuncture, chiropractic, cold laser. We did some natural joint supplements, the senior formula. At the time there was
DGP.
bone broth, DGP. So we basically tried to heal it naturally. And I knew that there was a pretty good chance that you know, we'd still end up where we ended up, which was about a year later. We were able to make it a full year, and she got back to playing in roughhousing. We thought that maybe we could make it through, and then she went to chase after a ball, yelped, and her leg was just hanging in the air, and she could not walk on it, put any weight on it at all. So at that point, I immediately knew that she fully tore her cruciate ligament. And I went in for a consultation, and they recommended a TPLO, which is actually they saw through the bone and then put plates and screws to basically reshape that joint so they don't even need a cruciate ligament anymore. There's another surgery, which I'm not sure, do you know the name of it, where they put in like the fake cruciate ligament? They basically, it's like a little string.
Oh, yeah, I can't remember.
But they offered that surgery as well, but they said because she's a large dog, she's 90 pounds now, she's supposed to be 80 pounds. But because she's a large, active, young dog, they said if we did that replacement surgery, there's a high probability it would fail. So I opted for the TPLO surgery, and that was 3 or 4 years ago at this point. And then, so fast forward, she healed completely from her TPLO, still did all of the joint support that we did originally when she partially tore her cruciate ligament to help her heal, and they have about a 50% chance of, once they tear one side, of tearing the other side, because that puts more stress on the other leg. We beat the odds. We were able to rehab her and really build up her strength and her body, so that way she still never tore her right knock on wood.
Yeah. Careful what you say.
Yeah, the last thing I need. So yeah, we were able to at least avoid that. At that point, I got pet insurance, so that's great.
Smart move. In our case,
Which
smart
I've
move.
used frequently. And so about a few months ago, I noticed she had a big scar on her leg where they did the TPLO surgery, and I noticed this little swelling on top of the scar. And I thought maybe, there was a piece of suture that never dissolved, or maybe just, some agitation, or she was looking at it. Long story short, that little bump got worse, and it started oozing a little bit of pus, and so I knew immediately when it started oozing pus that this was not good. Took her into my regular vet, who I love, and she did a culture, manipulated the joints, did a full exam, did some blood work. She did have a low-grade fever at the time, and so my veterinarian recommended a surgery consult because she was afraid there was an issue with the actual joints or the plates and screws or something related to the surgery because of the location. So then I went for a surgery consultation with Dr. Spodnik. He was amazing. And he said, yep, x-ray looks great. She healed perfectly, but there's a very rare chance of a basically late term infection. And the way he explained it to me is basically bacteria gets on the plates and screws and creates kind of like a biofilm, and the immune system and any oral antibiotics just cannot effectively fight off that infection. So the only treatment for that is to actually surgically remove the plates and screws, which in humans they typically remove the plates and screws anyway. They don't typically do it in dogs just to avoid a second surgery and because the complications of leaving the plates in are rare. Except for in my case, it happened to me. But poor Mila. But yeah, so this is actually kind of a normal, the infection part isn't, but this is removing the plates and screws is actually kind of a normal part of human medicine typically. And it was a much less intensive surgery and recovery, basically, because the bones had already completely healed long ago, and the plates and screws were essentially cosmetic and just causing infection. So they got them removed.
Is she lame since surgery?
Yeah, she can walk on all fours and limps a little bit. Depends on kind of as the pain meds are wearing off, she limps more. But yeah, she walked right out of the vet office, and the recovery is definitely going to be a lot less intense than it was for the TPLO.
So, for those of you who have never seen everything that goes into this, they gave Gwen the plate and the screws.
Those $1,500 plates and screws.
Yeah. So there's a big old plate and a whole bunch of screws. Nice and clean now.
Yeah.
So yeah, that's the hardware. She would have had a hard time going through those scanners at the airport.
Yeah. Yeah, she would have set off a metal detector for sure.
All right, so let's talk about how you're supporting Mila post-op.
Yeah, so pre-op, because as soon as I saw the pus, that usually means we've got some type of infection, and she was lethargic. So I immediately started her on like everything that we have for immune support. So I did the turkey tail tincture by Adored Beast, colostrum. She was on DGP because it was a bit painful. The senior formula, fish oil, bone broth. I feel like I'm forgetting something.
Did you give her UC2?
Yes, she normally gets UC2, yeah, just for joint health. And so post-op, I'm doing all of those things. She's not on DGP right now because she is on an NSAID, because it was a major surgery, and she's been on NSAIDs before without major complications. But she is on all the other stuff still.
So are you putting her on either the liver tonic or kidney health, something to help detox the anesthesia?
Yeah, so the other thing I forgot was Phytosflora, because I knew they were going to put her on antibiotics. So that's the probiotic. Yeah, so I really like I haven't done any of the kidney stuff, but I do like the liver tonic by Adored Beast. And that's part of her rotation.
Their liver tonic, if I remember correctly, has dandelion and some other things that are really supportive just for filtration in general.
Right, it's supposed to be like pancreas, liver, kidney.
Yeah, so you may have enough. Yeah, you may have enough just with that versus just giving a specific liver support that would only be like milk thistle, B vitamins, which the hepato support kind of falls more over there. Mm-hmm. So if you were using hepato support, I would add on either RX Renal or the Dr. Harvey's kidney. But with the Adored Beast liver tonic, it actually has things that are going to help with filtration through the kidneys. So it's a really good idea after anesthesia for a couple of weeks to give them a bit of a detox to help get that stuff out of their system, do kind of a cleanse that we need to do, and that'll help with healing. So one of the things that I think a lot of people are not aware of with these animals that have a cruciate tear, there's a lot of causes behind it. One certainly is conformation, anatomy, how they're built. So we see a lot of dogs that are very, what I call post-legged, very straight, instead of having the angles in their joints in the back leg. If they're very post-legged, they're really prone to tearing ligaments. Dogs who are deficient in some of the trace minerals, manganese is a big one. And so this is where little tweaks in the diet and having that rotation can be so important, because dogs that are low in manganese are more likely to tear a ligament. From a TCVM standpoint, ligaments are supported by liver blood. So if you have a liver blood deficiency, that can contribute to these tears. And one of the things that I learned through the years was that a misalignment in the spine, so basically needing chiropractic care, is huge. Dogs, there were some really good studies done years ago with dogs that blew out one cruciate. If they received ongoing chiropractic care after the initial surgery, they were much less likely to have the second leg go. And Mila has kind of off and on had acupuncture, cold laser, and chiropractic care. So I think that has helped with the knock on wood that she's not going to blow out another one.
Dr. Michelle Broadhurst also, like, obviously she does chiropractic, but she does a lot with the muscling. Because you can, like, obviously you can't really fix their conformation, but just like us, you can do physical therapy on certain muscle groups to make sure that you are supporting that joint and you're not, artificially putting more stress on it. So that, yeah, there definitely are a lot of options for preventative now. Like, next, hopefully Mila lives forever and we figure out how to make that happen before.
Lose 10 pounds.
Okay, yes, she's on a diet, yes. Got away from me. But other than that, yeah, my next dog, I definitely will be more proactive about, like, being more conscious with the chiropractic care and just, like, their musculoskeletal condition from a young age. Because I feel like within Mila's case, being able to prevent the right side from tearing, I am pretty confident that had I been more educated up front, we probably could have, built her up to the point where the left never even tore. And then she wouldn't have had the TPLO, and then she wouldn't have had this surgery either. So, yeah,
Cascade
would have saved quite a bit of surgery for poor Mila had I, just been more proactive when she was young. I mean, because I adopted her when she was only like a year and a half old, and she was skin and bones. So and she had like liquid diarrhea. So I was so concerned about her GI health and everything else that I didn't even think to get her muscling and stuff like that. Really.
So. Interesting, muscles are built and supported in TCVM by the digestive system, by the spleen. So Mila got off to a rough start there, which means that she wasn't getting that support as a youngster that she needed to get good muscling to support those joints. So it's really interesting, and that's why I like TCVM, because you can kind of keep peeling back the layers of the onion and say, yep, it all started right there. So really interesting. Who was I doing an interview with? Who did I interview yesterday? Or interview with? I don't even remember. But we were talking about peeling off the layers of the onion, and it was.
Oh, your workshop? Is that what you're talking about?
No, it was. basically asked me, when do we start with holistic care? And the answer was when they're weaned. Or even, even before weaning. Yeah. Well, actually, yes. Then we actually took it back to
when they're a zygote.
You start with the mother. You start with the bitch or the queen, and you make sure that their health is good. You get titers on them to make sure that they're going to pass on the antibodies to the offspring in the colostrum. So, yes, when do you start your holistic care? Before they're even born.
Yeah.
Well, before they're a twinkle in their mama's eye.
Yeah, exactly.
So, yeah, poor Mila didn't get that benefit.
No, well, I mean, we did fix her GI issues. She gained weight. She looked amazing.
Fixed it too well.
Yeah, well, now we did. But, so we did all these amazing things, but it's, hard to know until you know.
Until you know. So we keep learning. It's a process. So anyway... Mila may have put on some of that weight also because this thing obviously has been brewing for a while.
Yeah, and she's been more lethargic too.
Right. So she had this infection that's been brewing and probably more pain than what we realized as well. Because she's pretty stoic and she's
a very high pain tolerance.
And she's a couch potato given the choice.
Yeah.
So, yeah, there's that. Okay, everybody have a wonderful day. We are really, really busy. I'm going to do a taping with Dr. Dobias today.
You mentioned it in the Podega interview. Thank you. They're more on top of it than we are.
Thank you. I was like, who did I just do an interview with?
What?
Podega.
What did we do? Who were we talking?
What day of the week is it? We started this conversation with what day of the week is it? We're sleep deprived, coffee deprived.
Yeah.
And work overloaded.
Yeah.
Man, oh man. What are you gonna do?
All right.
Joey's looking pretty good for a guy who's another year older. Everybody have a great day. Well, I don't know how to end it since...
I guess just maybe close out the whole thing.
But then I don't know if it'll post it.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com.
Well,
I wonder if I can close it out on my phone.
I was about to say, maybe I can from here.
Facebook may just keep going forever. I don't know. All right, well, let me close out of Instagram first.
Wait, I am...
Surgery.
I don't think it'll let me do it on...
I'll try on my phone.
Well, I'm logged in.
You're logged in as me?
And it's not working, so I think we just gotta go for it.
Oh, it's probably gonna lose it.
Ah!
You know, Facebook, sometimes you make me a little nuts.
How does one stop it?
It's still spinning.
We could do
It says we're still starting, and Instagram isn't posting either. Oh my lord. Oh, there, that went. Okay, I'm just gonna do...
Oh, wait, it turned gray. What does that mean?
I think you're all.
You think so?
I don't think so. Oh, wait. No, I think
we're still going.
We're still live. So.
We're still live. Hi guys. Don't mind us. Technical difficulties.
Just now got your message that you're live. Oh joy, you're tuning in just at the right time.
You're tuning in just at the right time to see we can't stop.
We can't stop it. We're live on Facebook. All right, Dr. G. This is like one of the
save video.
What are those 24-hour things like the?
It says save video to new collection favorites or for
no,
later.
That's not. I think we just gotta rip the Band-Aid off and just hope that hope that it works.
I can pin the post.
I don't. I'm gonna have to trim this. There's a trim feature, so this is just a live only treat. I literally think we just have to close out of it.
All right, we're just gonna bite the bullet.
We're gonna do